All right. Hi, everybody. Good morning. And this is my second full board meeting. So I'm excited. I hope that I can cover all the material that is being presented. And I do have to say, if I may, as we're calling this meeting to order, that the work of the county is deep and persistent. And I want to commend all of you, the past and new board members, for being able to keep up with this pace, because it is it's a mighty, consistent pace of work. And I want to make sure that our public realizes the impressive amount of things you get done on a monthly basis and on an annual basis, which will be documented. And I just want to share with you these notebook that was put together by Jane for me. This is what we're covering today.
Wow.
So congratulations. Gotten a lot done. And also I would be remiss to continue this meeting without calling attention to what's happening here in Kane County and in our nation. I don't want to bring in politics, and I will not do that. But we are truly living, if I may paraphrase, best of times and the worst of times. And we certainly are living in the most interesting of times right now. And why politics are being fought across our nation and on our state capitol. Here in Kane County, I would like to make sure, and I'm sure all of you agree with me, that we are putting politics aside and doing what we're supposed to do, is in the essence of this notebook that I just shared to you, practicing good governance, because that's what we were hired to do. And I want to thank you for all of that as we continue helping and working for our constituents. So let us begin. May I please have the roll call?
Allen?
Allen, present.
Okay. Bates?
Bates, present.
Berman?
Berman here.
Brown?
Here.
Davist? Davist? Ford?
Here.
Fraz?
Here.
Gums?
Gums here.
Iqbal?
Iqbal present.
Kenyon?
Kenyon here.
Caius?
Caius present.
Opie?
Opie's here.
Leonard?
Leonard here.
Lewis? Lewis? Martin?
Martin present.
Molina?
Molina present.
Sanchez?
Here.
Shepro?
Present.
Silva?
Here.
Strathman?
Strathman, present.
Surgis?
Here.
Tepe?
Tepe here.
Weber?
Present.
Winicki?
Winicki, present.
Chairman, you have a quorum.
Thank you. Now, Jared Sanchez will be leading us in the Pledge of Allegiance and introducing the speaker for our invocation.
Pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That was better.
Good, well done. Mr. Sanchez, you want to introduce the speaker?
Yes, I invited Pastor Adam Parchert of the H2O Church in Carpentersville to lead us in the invocation today. Him and his church, the H2O Church, are very active in the community. They currently run a thrift shop in town, and they're very well known for their movies in the park events in the summertime that brings families together. They have a huge projector screen and they just fill the park up and everybody watches some great family movies and a lot of other good stuff that they do. I've run into them here and there, cleaning trash up and other things, you know, just being very active in the community. So that's Pastor Adam Parchert.
Thank you, Mr. Parchert, or Pastor Parchert, excuse me.
I'll answer to either. Thanks, everybody. Honored to be here this morning, and just won't pray long, but I'll pray as an invocation and let you guys get down to business. But sure do appreciate the opportunity. So let's pray. Heavenly Father, we thank you for this day and this time that we join together to do the business of the people of Kane County. As the people of Kane County live and raise families, work to put food on the table, run small businesses, large businesses, as kids are getting back to school now and either in person or at home, I just pray for wisdom for the board members as they work within the areas of influence that you've given them, and to make decisions that just honor the residents of Kane County and honor you. So I pray for the Holy Spirit to bring peace to our towns, our villages, and to our nation. I just pray for divisions to be healed, both just in our homes, the cities and towns we live in, our country. And I pray that we could all just be the best versions of ourselves possible. So Father, give us wisdom, give us patience, give us confidence to move forward in peace. And let's pray these things in your name. Amen.
Amen.
Thank you very much.
Thank you. May I now have the approval of the minutes?
So this says,
May I have a motion and a second to approve the minutes for both December 8th and December 21st meeting?
those are all the
Kaios?
Second.
courtrooms that we need to verify work, and then 203.
And board members, as you're speaking, since we have people online as well, could you please introduce yourself, recognizing you from here, but everybody online may not be able to see or hear you properly, so that would be a great convenience. Thank you. It'd be appreciated.
I did. Celeste.
And are there any changes or thoughts to the 2 minutes? Hearing none, seeing none here. May I have the roll call, please?
Allen?
Allen, aye.
Bates?
Bates, yes.
Berman?
Berman, yes.
Brown?
Brown, yes.
Davis, did you arrive?
Yes, Davis, yes.
Okay, thank you. Ford?
Yes.
Praz?
Yes.
Gums?
Gums, yes.
Iqbal?
Iqbal, yes.
Kenyon?
Yes.
Caius?
Caius, yes.
Kopi?
Kopi, yes.
Leonard?
Leonard, yes.
Lewis, did you arrive? Martin?
Martin, yes.
Molina?
Molina, yes.
Sanchez?
Yes.
Capro?
Yes.
Silva?
Yes.
Strathman?
Strathman, yes.
Sturgis?
Burgess, yes.
Tepe?
Tepe, yes.
Weber?
Yes.
Winnicke?
Yes.
That passes.
Okay, thank you. The next is presentation discussion for myself. We're going to be faced with a couple of interesting opportunities that you'll be voting on later on today, and I will leave that discussion when we approach both of those. That'll be the public information officer seeking your approval, and also the granting opportunity that we've been presented from the federal government to support rent relief for our neighbors in our community. So we'll leave that discussion for that time. So the next on the docket are the zoning petitions. May the John Martin rise, or not necessarily rise, but just attend to this information, please.
I don't mind. I'll rise at your pleasure, whatever you want.
You may sit, sir.
Thank you. Thank you, Madam Chair. We have 2 matters before us today. The first being petition 4563, filed by the petitioner Morningstar Community Church for property commonly known as 39 West 753 Prairie Street in Sugar Grove. What the petitioner is seeking is a rezoning of a portion of the property from E1 District Estate Residential to E3 District Estate Residential to allow the sale of an existing residence on the property. There was no Regional Plan Commission jurisdiction. The zoning board approved with 3 stipulations, and the development committee adopting those 3 stipulations also recommended approval. So I move approval of that and request a second. Mr. Leonard seconds.
100 seconds.
Would the clerk please call the roll?
Allen?
Allen, aye.
Bates?
Bates, aye.
Berman,
Berman, yes.
Brown,
Yes.
Davis,
Davis, yes.
Ford,
Yes.
Raz,
Yes.
Gums,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie. Yes. Leonard,
Leonard, yes.
Martin,
Martin, yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Yes.
Silva,
Yes.
Strathman,
Yes.
Sturgis,
Burgess, yes.
Pepe,
Tepe, yes.
Weber,
Yes.
Winnicki.
Wonecki, yes.
Passes.
Motion carries. That matter is approved. The second matter before us today is petition number 4564 in Caneville Township, filed by M-Wave Networks LLC. I've been advised by the staff this morning that we are in receipt of a last-minute objection, which neither the staff nor the committee has had a chance to evaluate. And on that premise, I believe it prudent to table this matter pending that review. So I move it be tabled. Mr. Fraz seconds. There being no discussion of a table vote, please call the roll.
Okay, this is to table. Okay, this is to table. Allen,
Allen.
Bates,
Bates, aye.
Berman,
Berman, yes.
Brown,
Yes.
Davis,
Davis, yes.
Ford, Fraz, Gums,
Gums, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Opie, yes.
Leonard,
Yes.
Martin,
Yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Silva,
Yes.
Strathman,
Strathman, yes.
Sturgis,
Burgess, yes.
Pepe,
B, yes.
Weber,
Yes.
Winnicki.
Wonecki, yes.
It passes.
Okay,
Motion carries. That concludes the hearings, Madam
thank
Chair.
you. Thank you very much. The next are appointments. Now, point of clarification, should we go through each one, State's Attorney Mosser, to appoint each one individually, or can I do that as a group? Okay, each one. Okay, thank you. All right, everybody. We have 1, 2, 3, 4, 5.
I note that the appointments are the.
Talk in your mic, Ken.
I've been using. The appointments that were made at an earlier meeting were done as a group, and I'm wondering if that wouldn't be possible in this instance as well.
I think so.
It's just a lot of roll calls.
Madam Chair,
Yes, thank you. Thank you, Mrs.
Madam
Mosser.
Chair, this is Mao Iqbal.
Yes, Mr. Iqbal?
I have a question. You are appointing these individuals for 4-year term when everyone is going for re-election at the end of 2 years. So I suggest that the term should be limited to December 2022.
23.
All right. We have some clarification on that. Hold on.
Thank you. Jody Welnick, Director and responsible for these appointees. The bylaws of the Stormwater Management Planning Committee, based on the state statute, are for 4 years. If any person on that committee were not to be reelected after the 2-year period, we would reappoint another person for that position.
Thank you for that
Oh,
clarification.
okay. Thank you.
That answers your question, Mr. Iqbal?
Yes, it does.
I'll move the appointments for the Kane County Stormwater Management Planning Committee.
Thank you.
Sturgis, second.
We have is there any other further discussion? I'd like to, hearing none and seeing none online, may I ask the clerk to call the roll, please?
Allen,
Allen, aye.
Bates,
Bates, aye.
Berman,
Berman, yes.
Brown,
Yes.
Davis,
Davis, yes.
Ford,
Yes.
Fraz,
Yes.
Gums,
Gums, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Leonard, yes.
Martin,
Martin, yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Silva,
Yes.
Strathman,
Yes.
Sturgis,
Yes.
Tepe,
Tepe, yes.
Weber,
Yes.
Winicky.
Wonicky, yes.
Okay, that passes.
All righty. I'd like to ask now to move to the resolutions and ordinances. Would anyone like to remove an item from the consent agenda? Yes, Mr. Shepro?
Yes, 21-05, please.
Anything else? All right. The 5 is removed. I would like to ask for a motion and a second to approve the consent agenda with the exception of 2105.
Motion.
And that, hold on, that motion is authorizing creation of public information officer position and related to fiscal year 2021 budget adjustment. Okay.
Alan moves.
Yes, Mr. Leonard?
Yes. Mr. Leonard seconds.
Okay, and who did the?
Alan.
Ellen.
Thank you. Okay. Okay. Clerk, may I please have the roll call?
Allen,
Alan, aye.
Bates,
Bates, aye.
Berman,
Berman, yes.
Brown,
Yes.
Davis,
Davis, yes.
Ford,
Yes.
Fraz,
Yes.
Gums,
Yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Leonard, yes.
Martin,
Martin, yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Silva,
Yes.
Strathman,
Yes.
Sturgis,
Burgess, yes.
Tepe,
Tepe, yes.
Weber,
Yes.
Winicky.
Wonicky, yes.
That passes.
So from a poker run to planting trees to repairing roads, bridges, the work this county does, it's commendable. Well done. So now may I have a motion and a second to discuss and approve 21.05, which was removed from the consent agenda.
So move.
Alan
Fraz moves, okay.
Okay, thank you. Is there any,
For second,
who's the second?
Mr.
Tepe.
Tepe.
Tepe, I'm sorry, okay.
Please make sure to shout your name out loud and proud.
Take my mask off.
Is there any discussion? Mr. Shepro?
Yes, Madam Chair, thank you. I certainly support this resolution. In reading it again last night, it appears to me that in the third whereas, there is a extra phrase that should be removed. Namely, as written, it says that we are hiring a qualified person to establish the position and hiring another qualified individual to fill the position. And I think the intent was that it should read that it is in the best interest of the county to establish the position and to hire a qualified individual, so forth. So I would move to amend the motion by striking in the third whereas of the resolution in the second line, the first phrase, to hire a qualified individual.
Okay, this is to amend.
Thank you for that. Is there any other further discussion on that matter? Hearing none, may I please have the roll call?
Okay, and this is on the amendment. Allen,
Alan.
Bates,
Bates, aye.
Berman,
Berman, yes.
Brown, Davis,
Davis, yes.
Ford,
Yes.
Fries,
Yes.
Gums,
Gums, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Tyus,
Tyus, yes.
Kopi,
Yes.
Leonard,
Leonard, yes.
Martin,
Martin, yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Silva,
Yes.
Strathman,
Yes.
Sturgis,
Burgess, yes.
Tepe,
Tepe, yes.
Weber,
Yes.
Winnicki.
Wonicky, yes.
Okay, that was on the amendment.
Thank you
Yeses.
very, very much. Truly appreciate it. I'm honored to have that support.
And now we vote on the original plus the
The
amendment.
original one, again, see, I'm just excited about having this opportunity. Oh my gosh. Can we have the roll call, please?
Okay, so as amended, we've got Fraz and Tepe. Is that okay? All right, this is for 2105 as amended. Allen.
Allen, aye.
Bates.
Bates, yes.
Berman.
Berman, yes.
Brown.
Yes.
Davis.
Davis, yes.
Ford.
Yes.
Yes.
Gums.
Gums, yes.
Iqbal.
Iqbal, yes.
Kenyon.
Yes.
Caius.
Tyus, yes.
Kopi.
Yes.
Leonard.
Leonard, yes.
Martin.
Martin, yes.
Molina.
Molina, yes.
Sanchez.
Yes.
Shepro.
Yes.
Silva.
Yes.
Strathman.
Yes.
Sturgis.
Yes.
Tepe.
Tepe, yes.
Weber.
Yes.
Winnicki.
Wonicky, yes.
That passes.
Wonderful. Good. Very good. The next item is declaring a vacancy in the Office of Treasurer and appointing an interim acting treasurer. May I have a motion? I'm sorry, and a second? Ford, second, Mr. Shepro.
So Ford moved and who second? I'm sorry.
Shepro.
Okay, thank you.
And do we have any discussion on the appointment of the interim treasurer? Mr. Shepro?
Thank you, Madam Chair. I would report that I have verified that the nominee's voting record would meet the requirements of state statute as far as, quote, membership in the same political party as the resigning officer. And so I think this is a fine appointment and hope everyone will support it.
Thank you. Is there any other discussion?
I'm not seeing, I don't know who I'm voting for here. I'm not seeing any information.
It is in the draft resolution.
Resolution 2124.
The deputy, Ms. Herrera.
Maria Herrera.
Okay, thank you.
Sure, my pleasure. And this, Maria, was the recommendation from our former treasurer record to act as the interim. And she has been with Kane County for a number of years.
Over 20.
Yes. So I think she'll be a good steward for us during this this transitional time.
Excuse me being naive. When we say interim, does that have a time frame? What does interim mean? How does that work?
Excellent question. We are asked by statute to replace, fully replace your treasurer, our treasurer, within a 60-day period. So this will be somebody who'll have the signature authority during that period of time and to manage the office. Is that correct?
Yes, that's correct.
Okay. And we will be, during this period of time, we will be putting together a committee which will be consisting of community members throughout Kane County. We will be putting out a general call, and I would like Mr. Shepro, as both my vice chair and head of the Republican Party here in Kane County, to perhaps elaborate on how this committee structure would work. Would you mind, sir?
No, thank you, Madam Chair. We did have the opportunity to review the procedures. Those of you with long memories may remember that when State's Attorney Barsanti resigned, the then chair appointed a committee of community leaders and in full compliance with the Open Meetings Act notice and so forth, public meetings were held. And that committee's task was to invite applications for the position, conduct interviews, obtain public input, and to make a recommendation to the county board chair, who is by law the officer vested with the authority by statute to fill the vacancy for the balance of Mr. Rickards' term, which would expire in December of, or maybe November 30th of 2022. And as you outlined, I believe the statute also says that that process should be completed in 60 days. So that's was the concept. I applaud this approach to it. I think it's about the most transparent we could get. Obviously, in the last time, Mr. McMahon was recommended to the chair, and the chair in turn recommended Mr. McMahon to the board. The only requirement besides being a registered voter is the statute does say that the person selected must be, quote, a member of the same political party as the individual who departed was at the time of his election. And if anybody has any questions about it, I'd be happy to answer them now or offline.
Ms. Winicki?
Thank you, Madam Chair. The appointment, is it ultimately with the advice and consent of the county board, or is it just
Correct.
specifically by the chairman?
No, the chairman makes the appointment, and the statute uses the phraseology, as you've noted, with the advice and consent of the county board.
Okay, thank you.
Any other thoughts or conversation about this or discussion? Hearing none, may I please have the roll call?
Allen?
Allen, aye.
Bates?
Bates, aye.
Berman?
Berman, yes.
Brown?
Yes.
Davist?
Davist, yes.
Ford?
Yes.
Fraz?
Yes.
Gums?
Gums, yes.
Iqbal?
Iqbal, yes.
Kenyon?
Yes.
Caius?
Caius, yes.
Opie?
Yes.
Leonard?
Leonard, yes.
Martin?
Martin, yes.
Molina?
Molina, yes.
Sanchez?
Yes.
Shepro?
Shepro, yes.
Silva?
Yes.
Strathman?
Strathman, yes.
Surgis?
Burgess, yes.
Tepe?
Tepe, yes.
Weber?
Yes.
Winicki?
Winicki, yes.
It passes.
Motion passes. The next is item 2125. And this is regarding the appointment of an interim executive director of building management.
Caius move.
Allen, second.
And who is? Caius.
I'm sorry, who moved?
Caius moved. Martin.
And who second?
I think Martin.
Oh, thank you.
We're not going to recognize anybody unless they say their name.
Yeah, say your name sometimes
You
because I'm
gotta-
looking down.
You got to say your name. Thank you. Is there any discussion? And this would be Chris Allen, who we are appointing. Name?
Drew Fraz speaking.
Yes, sir.
I'd just like to endorse Mr. Allen. I work with him almost on a daily basis with the new building construction as well as the Mill Creek SSA operations. And of course, I'm on the administration committee, which he reports to. And I think he would do a great job and is actually doing the job as we speak. So highly endorsed.
Thank you. Thank you. Any other comments? I did receive a letter of recommendation from our former Executive Director of Building Management, Ricky Sparks, and who also commended Mr. Allen's work and his ability to work collaboratively and just be, I think, just a good support for all of his team. So if Mr. Allen is in here, yeah, congratulations. Congratulations, but wait, you have to get the vote. So if there's no further discussion, may I please call the roll?
Allen.
Allen.
Bates.
Bates, congratulations. Yes.
Right. Thank you. Berman.
Berman, yes.
Brown.
Yes.
Davis.
Davis, yes.
Ford.
Yes.
Fraz.
Yes.
Gums.
Gums, yes.
Iqbal.
Iqbal, yes.
Kenyon.
Yes.
Caius.
Caius, yes.
Opie.
Opie, yes. All right, yes.
Martin.
Martin, yes.
Molina.
Molina, yes.
Sanchez.
Yes.
Shepro.
Shepro, yes.
Silva.
Yes.
Strathman.
Yes.
Surgis.
Surgis, yes.
Tepe.
Tepe, yes.
Weber.
Yes.
Winnicky.
Onicki, yes.
Thanks. 20. Okay, passes 23-0.
We're good. Okay, motion passes. The next item is number 2126, authorizing the application and acceptance of federal funding for emergency rental assistance program related to the COVID-19 pandemic.
Sanchez moves.
Tepe, so move.
I would like to second that.
Okay.
No, I wanted
Kenyon?
to second
Okay.
that.
I have it marked as Tepe motion, Kenyon second.
Didn't recognize that one. They didn't say their names. Thank you. I think we need to have some discussion on this, and I'd like to call up, just so we have complete clarification on what the program is all about, since this will be a new grant for us. Is Mr. Berger here?
Good morning, Madam Chair. I'm on the line. Can you hear me?
Thank you. Yes, we can. Can you give some explanation of how this came about and its quick progress? I should have said the expediency which we have to move to get this resolution approved.
Absolutely. To some of you, this program might sound a lot like the CARES Act. Remind you of the Coronavirus Relief Fund, or the CRF program as we've referred to it. It actually is not like that program. These funds aren't nearly as flexible as the Coronavirus Relief Fund was. That, for example, they can't be used to assist businesses, local government, or cover health and public safety type expenses. The Emergency Rent Assistance Program, as the name implies, is targeted to assist households with rent. And it's the federal government's effort to, in essence, shore up a key sector of the country's housing industry, specifically the rental sector. As you know, with the ongoing moratorium placed on evictions, landlords and potentially their lenders are put at a disadvantage and potentially suffering a financial hit as their tenants find themselves basically unable to pay their rent. The ERA program from the recent stimulus bill is aimed specifically at helping the lower income strata of that set of households. The Treasury Department under this program is making rent assistance funding available to all 50 states, Native American tribes, as well as large cities and counties with populations above 200,000. The Treasury Department indicates that a total allocation for all of Illinois is estimated at just shy of $835 million. Within Illinois, there are 10 counties and 1 city that, according to the data set used, have over 200,000 residents and are offered the opportunity to receive a portion of the state's allocation directly from the Treasury Department. Mr. Onzik received notice of our eligibility, I believe, last week. And I believe the deadline for making an application, should the county decide to do that, would be midnight tonight. Failing to make an application for funding does not result in a loss of assistance to our renters. Failing to make an application by midnight tonight simply means the state of Illinois would include our area in their program area and deliver assistance to our renters. And I'll speak to that in just a minute. If we choose to make application, we've been notified that our allocation amount would be just shy of $15 million. And under the guidelines that are established for this program, at least 90% of that amount would need to be used to provide direct assistance to low and moderate income renter households. That amount would be just over $14 million in financial assistance. So we've done some back of the envelope calculations, and assuming we would provide around $5,000 per household, we would be able to assist just over 2,800 households between the present and the end of the year. All the funds must be used by December 31st of 2021. Just to give you an idea of the type of households that would be targeted under this program, priority is placed on low-income households, which would be for a 4-person household, households with an income of at or below $45,500. And then as a second priority to middle income or moderate income households, which would be households with an income of not more than $72,800. So we've had some discussion internally and with Madam Chair over the county's options, and we have determined that the county does not have the capacity to stand up this program on its own. You can imagine that the rigor of taking applications from thousands of households, reviewing those applications for eligibility and suitability, ensuring that there's not a duplication of benefit under other programs would represent a very arduous and time-consuming, staff-intensive task. So short of letting our allocation go directly to the state, the one alternative that we've explored and discussed is actually to contract with the state under an intergovernmental agreement to ask them to deliver our program on our behalf. The state agency that is expected to deliver the statewide program under this initiative is the Illinois Housing Development Authority, the state's housing finance agency. We've worked closely with that agency over the years and enjoyed a partnership with them under multiple initiatives. And I'm happy to report that they do have a solid track record of administering this type of assistance and programming throughout the state, including Kane County. For example, this last summer, I had delivered a large-scale rent and mortgage assistance program under the state's Coronavirus Relief Fund program. That program was available to residents statewide, including Kane County. Even though we did receive our own allocation of CRF funds, the state made its CRF funds available to homeowners and renters in Kane County and throughout the metro area. During a brief multi-week application cycle for renters, ultimately over 1,000 Kane County renters were assisted under that initiative. So we're very happy to see that Kane County residents and renters specifically are clearly able to access resources that are made available by the state of Illinois through IDA. It's a very sound, well-run organization in our opinion. Obviously, there are a lot of details that would need to be pinned down before any sort of state-county partnership could be established. And pending the outcome of your decision regarding the resolution before you today, we would work with Mr. Sanchez and his committee to discuss those details with the idea of bringing forth a recommendation for how best to proceed. At this time, we do not have a backup alternative to simply working in partnership with the state of Illinois. So that concludes my comments. If there are any questions, I will do my best to answer them.
I believe we have one comment over here, a question.
Yes, Scott, as I understand.
May I please have your name?
Ken Shepro, sorry.
Thank you, Mr. Shepard.
I keep forgetting there's people that are watching. Scott, as I understand the program, the funds would be paid to the landlords, but for the benefit of specifically identifiable tenants who would then have a credit against whatever arrearage that there might be. Is that correct?
Generally, that is my understanding, although I do believe there are alternatives where that is not possible. I will say I believe that the Treasury guidance that we've seen, I think, limits the assistance to 12 months of rent assistance, and that includes arrearage as well as present rent obligations and rent obligations in the future months.
Thank you. And my second question is, your estimate of 2,800 households, do we have any notion of what the total need out there might be? I mean, the number of people who are households that are in arrears or might be eligible for this program?
We don't have good data on that. Again, since the moratorium is in effect, you know, the remedy that's available to landlords, that being eviction, where a renter cannot pay or does not pay their rent, is effectively not available to landlords. And so we don't have data on eviction information because the eviction system is basically suspended nationwide. However, I do have some data for you on the renter community in Kane County. We have about 45,000 renter-occupied households in Kane County. That represents about a quarter of all Kane County households. Nationally, I believe the national homeownership rate is just shy of 70%. Our homeownership rate is about 75% here in Kane. So of the 45,000 renter-occupied households, we're estimating, based on national reports, that a third to half of renters are delinquent to some degree, even if only a month or so. So doing back of the envelope calculations here, we could have anywhere between 15 and 22,000 renter households here in Kane that are in need of rent assistance. So the estimated number of households that we could serve with this just shy of $16 million allocation would be a small percentage of that. 2,800 is our estimate, which is why, thankfully, the state will provide additional rent assistance to our renter community under their ERA allocation. So the state of Illinois is going to be standing up and delivering a rent assistance program to your constituents, regardless of your decision on this resolution today.
Just one last clarification. Thank you for indulging me. Is my understanding that today, if we wish, we must take action to indicate we want the money, but the details of an IGA and so forth do not have to be accomplished today?
That is correct, but time would be of the essence. I believe the intention is for the Treasury to wire the money to the county, I think within a matter of about 3 weeks. And so obviously the pressure would be on to stand up a program quickly. And obviously with the deadline of December 31st, 2021, this is a large amount of money to administer on a relatively truncated time frame.
And just another point to that, all money has to be designated by the end of September of this year, September 30th, I believe, according to the agreement. Not necessarily spent, but allocated.
Thank you, Scott.
Madam Chairman?
Yeah. Yes?
This is Bates. Would it make sense, since it looks like we will only be able to help 1/5, about 20% of our needy households, if we give the $5,000 per household, would it make sense for us to maybe do $1,000 per household, which would give us a chance to do maybe 15,000 houses?
I believe that, if I just may speak, I believe that'll be the decision of the CARE Act Committee to make those determinations on how that money is going to be expended. No, right now, I think it's important that we talk not the details of how the money is going to be used, but just the approval of the receiving of the money, if that would be appropriate.
Okay, thank you.
Madam Chair, Vern Tepe here. I wanted to include with Scott's comments and notes. Last year, IHDC did have a plan and a program that was administered in this county. And I happen to own several rental houses, and quite a few of my tenants applied for this program. Key thing is that the tenant was required to apply for the program, but the landlord was required to provide the detailed documentation backing up, and in general, the funds went to the landlord. I will tell you that the process as far as the collection of information and the verification went very smoothly. There was very little feedback until you either got approved or rejected, which would be one of the criticisms of it. But there is another alternative in that all of our townships, and we have 16 of them here in this county, all of our townships have programs to work with people who are in arrears with their rent and utility payments. And that could be another alternative that could be taken advantage of. Although in my mind, that would be a second, not a first alternative.
Okay. Thank you. Thank you. Yes.
Mike Kenyon, accepting this money is a no-brainer. Our people are stressed by the need for food, the need for shelter, the need for employment. So we'll get one leg of that milk stool solid, we'll give them a place to live. And I'm so glad that something like this is happening with all the other stuff that's happening in this country. It's positive.
It is highly positive. Any other discussion?
I have a question.
Yes.
Thank you. Kopi. Where does this money originate? Is this a federal grant?
It's a federal grant.
All right.
That's correct. Any other discussion? And I did a quick Siri ask this morning, just to get an idea of where we are in Kane County as far as unemployment. And this is as of November. Kane County's unemployment rate is 6.2% as of November 30th. That is up 2% from the previous year. And then I took a look at our two large cities, Elgin and Aurora. Now, mindful, Aurora has, 4 counties within it, so this was just municipal Aurora. 6.1% in Aurora, and I know that there's pockets in Aurora that has a higher level of unemployment, and I would have to dig down further at that, but forgive me for just big picture on that. And Elgin is at 7%. So that's significant, considering that there are people who may not have opportunity to work. And being a woman, I can say that most of the unemployed people who are at home right now are women because their children are not able to attend school. They may be second income earners not to stereotype, but they may be second income earners for their families, and the primary income earner would necessarily have to continue to work. So there is a large impact upon our communities, and this program will be beneficial to keep our families and our children safe in their homes, and also to shore up what could possibly be a huge foreclosure rate here in Kane County for our landlords because they have to pay mortgages as well. So that stress would certainly be relieved. So I do urge all of your support for this very important grant that we were able to receive.
Madam Chair Gumbs.
Yes.
Thank you, Madam Chair. I appreciate the grant that we're getting, and I would lean toward in the intergovernment agreement so that we can process this better, as our staff is obviously leaning in that direction. I would support that.
Okay, all right, thank you. If there's no further discussion, Clerk, will you please call the roll?
Ellen.
Ellen?
Aye.
Okay.
Allen. Aye.
Bates?
Bates, aye.
Berman?
Berman, yes.
Brown?
Yes.
Davis?
Davis, yes.
Ford?
Yes.
Fraz,
Yes.
Gums,
Gums, yes.
Iqbal,
Iqbal, yes.
Kenyon,
Yes.
Caius,
Caius, yes.
Opie,
Yes.
Leonard,
Leonard, yes.
Martin,
Martin, yes.
Molina,
Molina, yes.
Sanchez,
Yes.
Shepro,
Shepro, yes.
Silva,
Yes.
Strathman,
Strathman, yes.
Surgis,
Surgis, yes.
Tepe,
Pepe, yes.
Weber,
Yes.
Winnicki.
Winnicki, yes.
Passes.
Fantastic. I will be working expeditiously with Mr. Onzik and Mrs. Herrera today to make sure that we get this grant submitted before end of workday today at 5. It's due at midnight, but they're all on alert. So as is Celeste. So we'll process this very quickly. If there's nothing else, I would like to have a motion and a second to go into executive session to discuss the settlement of claims and pending litigation.
Gums moves.
4 seconds.
I'm sorry, who moved? Gums?
Who moved?
Gums moves.
Gums.
Gums moved.
Board second, okay. For closed session.
Please call the roll.
Allen?
Allen.
To go in closed session, okay. Bates?
Bates, aye.
Berman?
Berman, yes.
Brown?
Yes.
Davis?
Davis, yes.
Ford?
Yes.
Fraz?
Yes.
Gums?
Yes.
Iqbal?
Good idea.
Iqbal, yes.
Kenyon?
Yes.
Caius?
Yes.
Leonard?
Leonard, yes.
Martin?
Martin, yes.
Molina?
Molina, yes.
Sanchez? Shepro? Silva?
Silva, yes.
Strathman?
Strathman, yes.
Surgis? Surgis?
Surgis, yes.
Tepe?
Pepe, yes.
Weber?
Yes.
Winnicki?
Yes.
All right, we are back in open session. May I have a motion to adjourn this meeting and schedule the next meeting on February 8th, 2021?
Madam Chair?
Yes.
Vern Tepe here. I'd like to ask a question.
Oh,
I'm sure that many of the other board members like myself are getting questions about vaccine and vaccine schedule and things of that information. I have found it difficult to get any kind of update as to what's going to happen associated with things. And I'd like to know when we can get a more detailed update from the health department on what's going to happen with vaccine scheduling.
Well, let me withdraw the motion to adjourn the meeting. And I would like to turn that over to Mr. Sanchez.
Thank you, Madam Chair. Next week, Wednesday the 20th, we have our next Public Health Committee meeting. I'm not going to guarantee that we are going to have the full unveiled plan for the 1B distribution at that meeting, but I can tell you that the Public Health Department is working on it. We have a plan that we're enacting right now. That is our standard vaccine distribution plan that is being given to the 1A category recipients. So 1B opens the pool up considerably. And so we're doing whatever we can to figure out how to build onto our infrastructure for distribution. Right now, the supply of vaccine is very low. So part of the issue people are having is why isn't it widely available? And it's because it's not widely available. It's not widely available to the governments distributing it. So as the supply increases, we'll start seeing more of it, and the 1B category opens up. We'll start seeing a progression in our community as more people get vaccinated. But I would ask for patience from the public simply because it is a huge undertaking. We are behind the schedule nationwide, and I guarantee it's going to be for similar reasons, that it's not just so simple to just hand this stuff out and to sign everyone up. I know we have a call this week. We will be talking about setting up some kind of portal for Kane County to have potentially to sign up for vaccines as they become available. So there are a lot of things in the works. I know it's not happening as quickly as some would like, but the reality of this type of undertaking is that it's very difficult and requires a lot of moving pieces and a lot of things getting figured out. So hopefully by next Wednesday, we'll have a good idea of where we're at on that and be able to unveil a little bit more to the public.
Well, I understand. I'm sorry.
Oh, as well as the website. We're talking about how to update the website as well to make it more user-friendly.
And I'd like to, if I may interrupt, we also have an addendum to that conversation as far as being able to develop a portal so that people can register. And I'd like to have Mr. Farnsock just briefly talk about that because it's very much in the planning stages.
Sure. If you want me to go or Mr. Copey?
Mr. Copey?
Yes, I understand that the information officer that will be upcoming will have a instrumental part in distributing this information also. Is that correct? Yep.
As soon as we get that individual hired, now that I have your full authorization to move forward on that, thank you.
Sorry, thank you. So my name is Roger Fonstock from the IT department for those online. The application or portal that they're discussing is really for the purposes of, one, notifying people of when vaccine is available. As Mr. Sanchez said, we're working on, the delivery of vaccine with the health department and sheriff, coordinating that in order to do the scheduling for appointments. So in 1A, that's a targeted audience that has very specific people that are being contacted to get the vaccine. In 1B, it opens up broader, and you're going to need to have appointment and scheduling. There are 3 different modes of scheduling that have been going on, maybe 4 if you count the paper and pencil method, but the 3 have been EM Track, which is a state-based solution, which is what the health department is recommending. There's also been some different talk about other scheduling solutions that are based on like a healthcare records system that has patient scheduling. So some of the really large counties are doing some things with their existing scheduling services to schedule people. I will tell you that any place that's taking appointment and scheduling right now is kind of putting people in a holding pattern because they haven't released 1B and they haven't started doing the scheduling. So we're working with the state with their deployment of a portal. They met this morning to talk about EM-Track and how that works. We've had training on it with probably a half a dozen or so county IT and health department employees. So we're ready to move with EM-Track. I believe they're putting some test sites in place for us to get the clinical people familiar with how the scheduling and processing works. And then the next part would be to start deploying that to the county's sites and then working with the PIO and the officials to get the word out. On the county health department's website, there is a notification system out there to notify you of when they're going to start the next steps with 1B. I think that some people have concerns because they want to know when they can schedule an appointment. They don't want to be notified when they can go schedule an appointment. They'd like to do the appointment. So that's where we're at. We're working on that little portal to get an appointment schedule process in place. I think this week we'll have a lot of progress as we get feedback from the different partners that are involved in that. I also would say that as they move into 1B, one of the things that the health department shared with us is there are private providers as well that are also working on the 1B, and they're going to be able to provide vaccines as well as the organized health department initiatives. So I think they had a list of 30 places that are certified with the state now to actually do the 1B vaccines. So I think a lot of this information is coming and it's going to come fast. I hope that we address all the issues that come up in the next week, but I think you're going to see a lot of things happening in the coming weeks.
Please, Mr. Tepe.
I always come after Sturgis, so nice to go before him on occasion. This all sounds well and good, but I'm getting phone calls every day from people saying what's happening. And if the county is involved in this, we need to have some level of information. For us not to have virtually anything, or just to say with people, well, there's a meeting next week and I'll know more then. To me, that's very disturbing. If there's something that can be put out, because people are seeing the rush to try to get a vaccine in Florida with lines that are days long, and they're saying, what's happening here? And I'm going to say, well, just be patient. I might have something in a week. That's not very satisfying. And it certainly does not make this body look good. We need some more information, and we need it now. Thank you.
I concur. Yes.
I have a... As a Sturgis here, as a healthcare executive, I had the opportunity, and let me start by saying Kathy Foster and Stacy Zeng, is that how you say her last name? Have just been wonderful. But we sent all our nurses and clinicians in on Thursday and Friday for the A1 to get done. And they said it could not have gone more smoothly. Everybody was incredible. I, of course, said, I don't need this. I'm not with the patients. Why would I do this? And Saturday morning, I had a flood of phone calls from my staff saying, you're an idiot. If you bring this into the office, we're going to hate you. So I called and said, can I get in? How do I get as an A1 with credentials? How do I get in there? And unfortunately, it's closed. And they said, we'll get back with you. But I think that at that A1 level, we need to have that flexibility for anybody. I mean, if there was somebody at a surgical center and they couldn't make it Thursday or Friday, we have to have that flexibility to get them in. Second thing, Vern, my parents have a go bag. And if we can get them to Florida because they're handing it out like candy and we're saying we can't even do it, I will put them on a flight tomorrow and send them to get this done and stay there for 3 weeks to get your second shot before we bring them back here. That's the dynamic. Saying that this is going to be a week or 10 days and we're going to have a second or third meeting, we need to expedite this and we need to do it absolutely right now. We can't wait for this information officer. We can't, it's go time. I mean, this is serious stuff. Every night I cringe when I hear on the news another batch of vials, the refrigerator went down and they can't be dispersed, and they're going to go in the garbage can because, oh my gosh, are you kidding me? Because we can't get out of our own way to get this done. We can do better. I know we can do better. How do we do it? And I'm appealing to everybody in this room. If we have it, how do we expedite this, please?
Thank you. Excuse me, Mr. Berman would like to speak.
Yes, as I understand, McHenry County is accepting people that are in the 1B classifications to send in their information. So at least some other counties are accepting candidates for that 1B.
To make reservations?
Making reservations, not reservations, just saying that they are in the eligible category. They have to have something to work from to make reservations, right?
I did have a follow up on that. We did have a discussion yesterday. I was online with the health department for well over an hour and a half discussing this issue. And I cannot tell you how firmly I requested that this platform be launched as quickly as possible. And I know there may be a cost with that, but I'm sure that under the emergency authorization, we all concur that this is going to be important. And as soon as we get the estimated cost and the legal approval, obviously there's going to have to be some authorization with that as well. I want to get this up and running as ASAP. They did make an announcement for those people who happen to watch Channel 5. Having my coffee, preparing for the board meeting, and here comes Kane County saying that within 2 weeks, they're going to be accepting 1B. I ran to take a picture of it, and by the time I got my phone, the slide had gone off the TV. But that has been a public announcement, so we are charged within 2 weeks, since it has been now broadcast, to make sure that this is happening efficiently and effectively. So just to give you a heads up on that. Yes,
Madam Chair.
Oh, wait a minute. Mr. Iqbal?
Madam Chair, this is Mo Iqbal, yes. Yeah, I have a question. I'm getting a few inquiries too, and I have approached the state senator as well. The fact of the matter is that the county has no authority or has no vaccine to deliver, and this registration matter is just a mirage. It's an illusion. It doesn't do anything. Governor has all the authority. When it says go, Group B will go, we will go. And we should make it very clear to the people that we have no authority. We have no vaccine. And when it comes, it will come to CVS and Walgreens. We can line up and get it there. Very simple.
Not correct.
This is what I understand. Maybe I'm wrong. Maybe you have vaccine and you are not giving it. That's what people want to know. You have it or you don't.
Mr. Ford. Thank you, Mr. Iqbal.
Yes, thank you, Madam Chair. My question was just, can we say what percentage of 1A that we have completed, or?
What was that PowerPoint?
I know that they were looking at the first round of 1A, I believe, was supposed to be finished this week, and then they still have their second round shot. So that's going to be, going on for a couple more weeks, I believe. And then there's a kind of a flow to this where some people in 1A didn't choose to get vaccinated, and those would actually carry over kind of in a wave, and they're still eligible even as you move to 1B. So you're going to see people in that 1A category kind of trickle in after the initial push that are going to get vaccinated maybe in B or
How fast can I trickle in on that?
Well, what you're seeing is that there's the supply and demand from the state vaccines that are coming in. the health department is receiving vaccines and notices that the vaccines are coming in. They're preparing for 1B. 1B is a large group. It's I think we said the seniors over 65 group was 75 plus thousand, and then they have all the essential workers added to that, which is even larger. So you're going to see, 1A continue to finish in the next couple weeks, and then you're going to move into 1B in the next couple weeks as well and start seeing that roll in. I think that from, where we're at right now, the most important strategic thing is how do you start dealing with the scheduling? And that is what Madam Chairman asked us to work towards, was to get the scheduling. I would say that in response to other counties and what they're doing, I went through the registration for 2 of the counties yesterday. And when you get done and you fill it out, it tells you that you're not eligible under the current categories, and basically sends you a nice message saying you can't schedule. So, having experienced it and going through their systems and checking boxes that indicated that I had eligible 1B types of whatever, conditions, it still said, that you were not eligible for a vaccine yet. So,
excuse me, Roger, just to be specific to Mo's question, when you say that you went online and you filled this out, with whom?
I went and experimented with Lake County's system and with a couple of other counties that have systems just to see what they were doing.
Got it.
And Lake County is probably one of the most well-known. They have an all-vax solution that they're advertising, and they have a lot of people that have signed up to get notified when the vaccines are available. We have a method to sign up for notifications now, but I think the limit is that we're not trying to categorically survey the population. We're just collecting their information, an email address, and then sending them a message back saying when 1B is going to happen or when we're going to start taking schedules. I think that the direction we received yesterday was to get something that collects the people's information, puts them in their proper groupings, and then is ready to contact them for the scheduling when it's available, not just simply tell them that, hey, we're at the next step, here's a notice. So that's what we're working towards. That's what we're trying to get with the health department. But I think that some of the existing perception is that there's people out there registering and getting vaccinated for 1B or other things. And I don't know that that's the case. It's they're taking names and they'll put you through their questions and then they classify you. That's what we're looking at is if I get your name, do I know if you're in the 65 and older category? You're qualified for 1B then. We can put you in a group. The second it's available, send you the scheduler that's available from the state. That's kind of the methodology that I think would be available. So,
and Roger, just because you seem to be in the know on this, to answer Mo's question again, because I think we all have the same question, do we as a county have these refrigerators that I thought we purchased through PPP with the vials in it? So Mo, we're in control of our own stuff.
Well, each of the 30 certified FQHCs, right, fully qualified healthcare providers, each of them certify and they tell you how many vaccines they can hold in their refrigerator freezer units. And that's what they're allowed to have or allowed to receive on delivery. So Kane County's, system of refrigerators is, a certain number. And that's what we're limited to because of capacity and refrigeration. You can't take more, but they don't want you to take less. So it's kind of a delivery logistics. And some places are very small and they handle, 30 vaccines at a time. Some are large, thousands of vaccines at a time. So it's those 30 partners are what you're looking at right now from a distribution perspective. There's about 30 in that list. There's others that I believe Kathy Foster, the executive director, said are coming on board. So you'll see like, Jewel Osco, CVS, Walgreens, they don't even have all of their stores certified and in the system yet. They're getting them onboarded weekly. So as they certify, they get approved. They tell them how many they can handle, how their refrigerator capacity, those types of things. So that's going to continue to grow in the next couple of weeks, the number of places that will be able to do this. for 1B. In the meantime, you know, we have to take care of our own responsibility, which is getting something for the registering and kind of classifying of groups of people, so we can get back to them quickly once we're ready and we have the shipment of the vaccine in hand.
So our freezers are not the holding tank or the wholesale portion for these other 30.
That's correct.
Our
That's correct.
freezers are ours that we're distributing out.
No, and just to clarify again,
Yeah.
that we're talking about two different vaccines. The Pfizer vaccine is the one that needs to be incredibly cold. Like, what is it, like 92, minus 92 degrees or something like that.
Yeah.
And those are going directly from the delivery portal. Sometimes they're delivered to Kane County Health Department. Sometimes they're delivered directly to a hospital. And then they are dispersed immediately out to the hospitals for the Pfizer. That's the initial outlay for the healthcare providers. To go on with that, in some of our hospitals, when the vaccine was able to be provided, and it's all about logistics, 40% of that hospital staff at one hospital deferred, opted not to get the current vaccine. So that pushes that 40% of that population back, which means we have a larger pool who will go on to the next round. The same thing with nursing homes. When CVS or Walgreens goes into the qualified nursing homes for patients to receive it, if the nursing home patients choose not to get the vaccine, they're pulled back as well. So that means there's going to be another redistribution when that opportunity happens. So we've got these vaccines working through. When the governor decided to open up the portal to people who are 65 and older, that population here in Kane County is approximately 75,000 people. So to adequately serve 75,000 people, we don't want the long lines that we've seen in Florida. We don't want a bunch of people sitting in the car overnight, concerned or in their pajamas in this cold, waiting to get the vaccine. We want to make sure we're doing it in an appropriate, methodical method, that everyone is able to make an appointment appropriately and receive the vaccine in a timely manner and an efficient manner. Right now, the 30 providers are seeing the list. To Roger's point, only 2 of our OSCO stores here in Kane County have been authorized. The Walmarts are very small as well, because they have to go through, if they're getting accepted the Pfizer, they have to go through the approval standards and making sure that they've got the methodology and equipment to store these vaccines. So the logistics of being able to inoculate this 1B very large pool, which includes postal workers, anybody who's affected with education, from our teachers, principals, cafeteria workers, aides, that is probably one of our largest employers, our school districts here in Kane County. I estimate, I don't know, maybe 15,000 people. Maybe, I'm just giving a rough number, maybe more, a little less, being able to get that logistics out as well. And to get all of those vaccines here in Kane County to be able to distribute them effectively. So I too am getting a lot of comments from people. It started 1, now I'm getting 4 or 5 emails a day, and I'm also getting phone calls. So that's why the sudden urgency when we had this conversation yesterday with the health department, saying that we've got to do it now. We have to be effective and we have to do it well, and not to under-deliver. Because logistics on this, if we don't do it right, we're going to cost people's lives. So this, I said, we live in interesting times. Yes. No. Mr. Tepe, you've had a chance to talk. I'd like to give somebody else. Mr. Sanchez.
Thank you, Madam Chair. Just 2 quick points. One, there's always a difference between expectation and reality. The expectation being we have the scenario going on, the vaccines exist, the government has all this money, the taxpayers' money to play with. You should be doing this right now. This should have already been put in place immediately. Why is it not? That's the expectation side. The reality side, we have to understand as county board members that the public health department is funded primarily by the Riverboat grant. So you get some money from the Riverboat grant and the rest of it comes from grants that they get from the state and federal level. So the public health department is operating with a very thin budget with very specific uses. We are also under 8 years of a tax levy freeze, which there are pros and cons to it. The pros being we have reduced our expenditures, our waste. You know, coming onto the board, I thought we were going to find all kinds of stuff in the budget. No, we have a very tight, lean budget. The mandated study that came out a few years ago showed us that. We didn't have many places to cut. We're down to the bone. So we have a public health department with a small budget that is, some would say, understaffed. We don't have enough staff to handle a pandemic. So they have their normal jobs, and this entire year, well, almost entirety of 2020, and now they've been dealing with COVID. They've been dealing with contact tracing, organizing all these things, the logistics of it all. So the reality is it's not easy to just snap our fingers and put things out there because we think they should be there right now. As I said, the vaccine is still trickling in. So it's going to be some time before we even have supply to make any kind of significant change in how many people are vaccinated. But obviously we're doing the best we can. The second point, a point of comparison, I think it was Mr. Berman that mentioned McHenry County, a close county to where I live. They have a portal where you can register for vaccines, but actually they have something similar, very similar to what we have. It's just worded a little bit differently. It's a sign up for information for when things are available. So it's not even putting you in line. It's just putting you on a mailing list, an email list to let you know now you can sign up. When we're ready, you can sign up for a vaccine. So McHenry County is doing the same thing we are, just with different words.
Okay, thank you. Yes, Mr. Tepe.
Madam Chair, again, my frustration is a total lack of information, and I still have yet to hear anything other than there's a meeting next week at which you'll find out more. I find that personally to be very unsatisfactory. I don't mind telling people this is what's happening. It's going to be this, it's going to be that. But to say, gee, I don't know, there's a meeting next week and I might know something is to me pretty lame. And that's how the people that are calling me and expect an answer feel. So I think we need more than that. And I don't see any reason why it can't be distributed to the county board members within a day of this is what's happening and this is what. And if what is happening is there's going to be a program that you can register and that program will be available, that's fine. But to say, I'm going to wait till next week for a meeting is just, to me, not satisfactory. Thank you.
Thank you for your concerns. Yes.
Thank you. To me, the logics are very simple. It wasn't very long ago there was no coronavirus, and it wasn't very long ago where the federal government was mandating moves and maneuvers and equipment and manpower and funds to combat this situation. And as far as human history goes, the invention of the virus or the vaccine was literally, 5 seconds ago, and on that scale. So to say that we are negligent and that we're not using the tools are coming at us, and we're doing the best that we can. To lay blame on staff or the county board for not being, not handling this appropriately, I take offense to it. I apologize, but your point is well taken.
Mr. Wodnicki?
Thank you, Madam Chairman. I concur with Tom. Unfortunately, we're in a transition stage at the Kane County Health Department with Barbara Jeffers retiring. She was phenomenal and very experienced. Now we have a new executive director we've just really appointed that's trying to find her way.
As an interim.
Exactly. And so we need to be patient and give her a chance. And I'm sure she would have been here at our county board meeting, like Barb Jeffers would normally show up and give us an update, but she's probably overwhelmed is what I think. So we need to be a little bit patient and not put the blame on anybody. I agree with that.
Yes.
To my colleagues, we're not looking to place blame in any way, shape, or form. We are honestly doing the best we can. But son of a gun, it doesn't take a brain surgeon to say, we received 50,000 vials of the vaccine. We've distributed 30. We have 20 left. Or whatever the math is. That's not an unfair question to ask and for Vern to have the answer to, or Tom to have the answer to, and say, listen, of those 50, we gave off 25 and 25 are for round 2. So we're empty. We don't have any bullets left in the gun. But to not have that information is what's killing us. And then to be guessing, well, do we have it, or does the state have it, or does the hospital? Who has our allocation? No blame, just information. That's all we're looking for.
One more comment.
Am I wrong, or didn't I read all of this stuff in Kane County Connects? How many doses we've got, what we've done with it? I mean, I just don't, I don't want to, you know, we don't have it. Okay, and so the answer is what we've got, we've distributed, and when we get more, we'll distribute that. And there's not going to be a lot of definition to it, no matter how well we do this, because different health providers are going to be providing parts of it. You know, if I'm envisioning, you know, that you know, my healthcare providers are on my chart. I presume that at some point in time, I'm going to get a notification from Northwestern or whomever is on my chart that you know, here you go. And that maybe is part of a plan, but the answer is we don't have it. And the easiest way to answer people as they call right now is to saying what we have, we've distributed, and we don't have any control over when we get it. We can't create facts that don't exist. And until we need a superstructure, we need a plan, we need to do all of that in a wise manner. But the clearest answer today is what we have, we've distributed. And that is available. That information was on Kane County Connects. And to me, that's, you know, if those are the questions people are answering, the answer is what we have, we've distributed. If we were getting 150,000 doses, you know, then you're talking logistics and everything else. When it's dribbling in at like 15,000 doses, you know, the healthcare people justifiably have used that, and we still haven't taken care of it all. So I think that we need to measure our response based upon what our capacity is. And the fact is that with the capacity we have, meaning how many doses have we got, we've distributed it.
If I may, and then we can continue the conversation. From what I am hearing, requirement or request of the board to solidify some of this conversation is I will talk to the health department, and what I'd like them to do is to put together a fact sheet for you, a brief summary of information, how many vaccines we have distributed as a county, where they have gone, because we know we're focusing on 1A, and that data is available. What the expectations are for the distribution for 1B, what the plan is for the distribution of 1B, even if it's a plan that is being logistically worked out, so that you have 5 or 10 factual talking points that you can reference back to your constituents who may have that information. And we can certainly make sure that it's crafted well enough that if you choose to do it via email or through conversation, we'll all be on the same page based on the facts that are given to us based on data, pure data, and science rather than supposition. Is that what I'm hearing you would all like to have?
Thank you, Madam Chair.
Madam Chair Gums.
Hold on just a second, Mrs. Gums. Yes, Mr. Frost.
Drew Frost speaking. I'm just looking at my emails from Friday. Kane County Health Department COVID-19 weekly briefing spells all that out. It's got multiple attachments and charts. I think it's everything that's been asked for. So it's from Rachel Farley, Executive Assistant, Kane County Health Department.
I don't get that brief.
That was Friday.
And it just, from my previous experience, it takes 7 times to communicate something. So maybe we're in part 2. But we've got to make sure that communication is really done 7 times, and it can be through various different portals. I think Ms. Gumbs.
Thank you, Madam Chair. I just want to thank everybody for their comments. I think we're on a consensus here about what we're looking for. Vern, I agree. I think the messaging is the key issue. There's a lot of information available to each board member. I agree, however, that we should have that message available to give to those folks that are coming at us in a unified manner. Obviously, with our new position taking place, that's going to solve itself. Until then, I appreciate your suggestion, and I think that a communication to the board would be greatly appreciated, and I think everybody's on the same message here.
Okay, very good. Yes, Mr. Martin.
Not to be petty, but if, to Drew's point, we have data here that today we're asking questions about as if it doesn't exist.
Oh, I agree.
It is the board members' obligation to review this stuff when it comes in and not create additional work for the health department who has valid stuff to do. I mean, fine, we can get this chart, but based upon a couple of comments today, meaning, Kane County Connects and what we've received from the health department, to me, that's, if I get a phone call from a constituent, the answer is we've given out everything we've gotten and we're working on the distribution method for when it comes in the future, and we don't know when we're going to get it in the future because it doesn't come from us. We don't control the delivery to the county. I mean, that's, to me, those are the 2 points that have validity, and it's simpler than creating a fool's mission of trying to predict the unpredictable.
Oh, we cannot predict the unpredictable, but if I may, I will ask the health department to put together just 5 or 6 points, to just do a quick summary sheet, so that when you are talking to your constituents, you have the facts right in front of you, and maybe, put them in your wallet or in your purse, that you can simply pull them out. I think it will be helpful. That'll be one of the 7 points of communication. So is there any other discussion on this very important, very, very important topic?
I want to adjourn.
Thank you.
Get out and carry this information.
Thank you
question
very
on
much.
that. Call the question.
Was it in the form of a motion?
Yes.
Yes.
I second.
I'll second it.
We have a $15 million grant I have to get authorized and get out the door, please. To
Okay.
protect
So
our
Kenya
housing.
motioned and
Voice vote.
Mr. Martin second.
Okay, may you please call the roll?
Voice vote.
Voice vote, that's right. All right, here we go, voice vote. Aye.
Aye.
All in favor, any opposed?
Thank
Meeting
you,
is
Madam
adjourned. Thank you
Chairman.
very much. Yes.